Intramuscular injections involve placing medication into the muscle. As part of infection control, you must adhere to the 5 moments of hand hygiene. Perform hand hygiene as part of reducing the transmission of microorganisms. As part of maintaining a therapeutic relationship, make sure that you introduce yourself, explain the procedure to the patient, and gain consent. At this point, make sure that you also explain to the patient potential side effects of the medication. When confirming patient identity, ask the patient to state their full name and date of birth, use the medication chart and the patient armband to confirm full name, date of birth, and medical record number. Check for allergies. Confirm that the prescription is legal and valid. Perform the first check of the 5 rights, comparing the product to the prescription on the medication chart. Preparing the injection. Collect the appropriate equipment. Here you can see I have 2 kidney dishes. What I have picked up now is a 3 ml syringe. This is my medication that I'll be drawing up. Check for expiry of the medication. Here is a blunt drawing up needle. It's 18 gauge and it doesn't have a beveled end. It's not sharp. Here is my 23 gauge needle, which is what I will eventually attach to the syringe, and this is what will be used for the injection into the muscle. I also have there my alcohol wipe. So now I'm taking out my 3 ml syringe. I'm trying to keep one kidney dish just for sharps and the other one for any other rubbish. That way at the end, I can just tip the kidney dish contents with the exposed sharps straight into the sharps container. What I've attached here is my blunt drawing up needle. As I said, it doesn't have a sharp end, but it'll be used just to take out and draw up the medication from the ampule. So I'm just drawing back, pushing out any air, and making sure that I have the accurate dose in my syringe. I can recap that because it doesn't have a sharp end. I'm taking that off and I'm going to place on my 23 gauge needle. So again, I'm going to leave this one capped into a kidney dish, and that's what's going to be used for the injection. I can put my blunt drawing up needle in there, as I said, so that at the end it can go straight into the sharps bin. We're now doing our second check of the medication, and this is being done with another nurse because any injection needs to be confirmed with another nurse. Upon entering the patient bed space, perform the 5 moments of hand hygiene. You can now perform your third check of the medications. This third check must be done at the patient bedside, and a patient identity check must be performed at this point. When doing this check, ensure that you are comparing the product or the vial of the medication to the prescription. Select the appropriate injection site. I've selected the vastus lateralis site. To help relax the muscle, ask the patient to lie flat with the knee slightly flexed. It's located on the anterior lateral aspect of the thigh and extends in an adult from a hand width above the knee to a hand width below the greater trochanter of the femur. The middle third of the muscle is the suggested site for injection. Clean the site with an antiseptic swab. Apply the swab at the center of the site and rotate outwards in a circular direction for about 5 centimeters. I leave the alcohol wipe pointing to the area that I have cleaned. Remove the needle cap from the needle by pulling it straight off. Insert the needle quickly at a 90-degree angle into the muscle. Position the non-dominant hand at the proper anatomical landmarks and pull the skin down to administer in a Z-track. It creates a zigzag path through tissues that seals the needle track to avoid leaking of medication into the subcutaneous tissue. After the needle enters, grasp the lower end of the syringe barrel with the non-dominant hand. Move the dominant hand to the end of the plunger. Avoid moving the syringe while slowly pulling back on the plunger to aspirate the medication. Aspiration of the blood into the syringe indicates an intravenous placement of the needle. Discard the uncapped needle into a puncture and leak-proof receptacle, and for me this is my kidney dish, which I will then tip directly into the sharps receptacle after I have concluded my interaction with the patient. Help the patient to a comfortable position. Doing a properly performed injection requires smooth manipulation of the syringe parts. Movement of the syringe may displace the needle and cause the patient discomfort. I remove my disposable gloves and perform hand hygiene. I conclude the interaction with the patient, discard my rubbish, and tip the contents of my kidney dish with the exposed sharp in it, directly into the sharps bin. Complete accurate documentation.